someone who can provide them the kind of support. What we often also find is that in those communities, there are good networks of family members who have experience with breastfeeding. And so we shouldn't always depend on, it has to be a healthcare professional who's gotten professional training. We do think that that's important, and we should increase access to that around the world. But certainly in communities where they just don't have much access to healthcare, we shouldn't be ignoring the fact that families are also important.
That's right. Interesting what you said earlier, Larry, about breastfeeding in high-income country versus in low-income country. What are the different challenges? Why sometimes in high-income countries we actually see lower breastfeeding rate?
So there are a number of reasons. One is the availability of infant formula. Formula has been marketed and promoted quite extensively in high-income countries for a very long time. The affordability of being able to purchase that formula can sometimes make it a lot more accessible in high-income countries, and so it becomes more of the social norm that it's an easy way to feed your baby. If you just get a bottle and just feed, and you don't have to be around the baby. And the industry has really taken up an approach of kind of capitalizing on those needs to push their products, and they've done it for a very long time in high-income countries. There are also issues of going back to work. Oftentimes, employment is outside the home, and therefore it makes it more difficult for breastfeeding to happen. In many high-income countries, they don't have adequate protections of women, so they're forced to go back to work much earlier than would be in our recommendations, and that makes it very difficult to continue breastfeeding. And so they just feel that, well, they have to turn to another alternative. From our standpoint, we would argue we need to fix those systems. We need to change the laws around paid maternity leave so that women are protected from having to go back to work so soon. We need to have protections at the workplace so that she can continue breastfeeding, even if she is working at the workplace. I do think that we're learning a lot, excuse me, we're learning a lot because of this pandemic about how people can work from home, how to communicate and do their work in other ways that in the long run potentially actually could be beneficial to breastfeeding and supporting them to be able to stay with their babies while they continue to work. But we're still working through many of those.
Interesting. Yes, some colleagues in the Department of Communication actually became new mom recently. And some of them actually said that the support that they're getting these days during the first few months is great, but they're also worried about the support that they're getting or consultancy that they're getting once they return to work. What kind of support, because it's for them it's a different game, so to speak, when you need to use the breast pump and all that, like how to keep going. What kind of support that breastfeeding working mom could get, Larry?
So first, just building on what you were just talking about, the need for people to provide that support. It's important that we remember that women need to continue getting support throughout the first 2 years of their baby's lives. WHO recommends that breastfeeding should go for at least 24 months, and even beyond that if the mother and baby are both happy with it and want to continue. So we need to continue to provide that support. Oftentimes healthcare systems are just set up to support the mom in the first 6 weeks, and then, okay, she's fine with her breastfeeding and she can go off on her own. But there continue to be challenges with maintaining a milk supply, new issues of feeding the baby, and new issues with having to go back to work and changing family situations. So that continued support with additional breastfeeding counseling support, asking questions of healthcare providers, working with community health workers, mother-to-mother support groups, are all ways to address some of those challenges that continue to arise throughout the first 2 years of life. In addition to that direct one-on-one kind of support from skilled breastfeeding support, it's also important that we figure out ways to accommodate a mother in the situations that she's in. Oftentimes that is needing to go back to work, and so she has to figure out how she's going to care for her baby as well as get her work done. Situations of going back to school, oftentimes young mothers are still involved in education. How can they continue to be involved in their classes and continue breastfeeding? And so we need to have better legal protections for women, as well as just change the societal norms, that there's an expectation that if you have a baby, you're going to need to be taking care of that baby and providing support, including breastfeeding.
Right. Thank you, Larry. There are follow-up questions on that. You mentioned about protecting mothers. We got a question from Facebook from Amal Omer Salim, who asked, what should government do to protect breastfeeding from rampant marketing of infant formula, especially during the pandemic?
So we really have to stop the promotion of infant formula. The promotion that's happening sometimes directly where you're seeing a product, but also indirect through pulling mothers into social groups, maybe they're online groups, where the messages from the companies are coming into the conversation and changing the way she thinks about feeding her baby. Companies are taking advantage of these ways of promoting their products and dissuading mothers from breastfeeding, that we all know is the healthier option. So governments need to step up and stop this kind of promotion. We need to have stronger legislation that controls the kind of promotion that can happen, the way the products can be marketed. WHO has long, since the 1980s, had policies on a code of marketing of breast milk substitutes. How do we actually stop companies from promoting their products? That doesn't mean that we want them to stop having them. We need to have formula for those babies who actually need it. So we don't want to stop access to it. So there's a right for them to be in environments that you can make formula accessible. But we don't want them to be promoting it directly to mothers or directly to the population, or to be pushing them on healthcare professionals. And therefore, we call on governments to strengthen their legislation. Make sure that they're covering all of the provisions in WHO's set of rules within that code of marketing and subsequent resolutions that have refined some of the rules themselves. And that they don't just pass the legislation, but they also enforce their legislation. What we actually see in many countries is that there is legislation on the books, but we still see violations all the time. And it's because they're not actually taking action to step up with a sanction on companies and make sure that they're stopping those practices. So we're calling on countries all the time to strengthen and make sure they're enforcing the laws that they do have.
Mm-hmm. You mentioned about healthcare worker and skilled breastfeeding counseling. What role that they should play in terms of limiting this access to infant formula?
So the code of marketing of breast milk substitutes that I mentioned a moment ago has a number of provisions laid out for healthcare professionals. And in fact, WHO has created a frequently asked questions document that's available on our website for healthcare professionals on what their responsibilities are. It's not just saying the industry shouldn't be doing these things, but it also says how should healthcare workers be interacting with industry. They shouldn't be accepting free gifts. They shouldn't be attending conferences that are paid for by industry. They shouldn't have their associations accepting funding from industry. They shouldn't be getting their education paid for by industry. They shouldn't accept any free gifts of either formula supplies or of even small little things, little pens and pencils or pads of paper, because those come up as constant reminders of this company and what they've given to us. And there's a literature on conflict of interest that actually shows that people, even when they've gotten very small gifts, feel a certain sense of obligation that they need to do something back for the person who has given them something. And so these gifts from industry actually change the way healthcare workers prescribe products and the way they counsel their mothers. It changes the way they talk, the way they think, and we really have to stop those kinds of practices. Healthcare workers really need to protect themselves against influence from industry.
Interesting. Thank you, Larry. It's like subliminal message in a way. Huh?
It is. It is indeed.
Mm-hmm. We're getting questions. more from our followers, from Muhammad, who are asking, what if the mother with COVID actually coughing actively? Is it really okay to put on face mask and breastfeed? Maybe you can repeat again the answer.
So we still recommend breastfeeding because of the importance of breastfeeding. And as I said, there really hasn't been documented transmission of the virus. We do recommend that she should be wearing a mask to hold all of that coughing in. She's not getting the respiratory drops all over the baby. And we would recommend that she's coughing into a sleeve, turning away from the baby in addition, and that she's washing and cleaning everything that she might have come in contact with. So if she's getting it on her hands or she's getting it on her elbow, that those surfaces also get cleaned, because we know it's through those respiratory drops. It's those fluids that are passing the virus on to a baby. And so as long as she's protecting herself or protecting her baby through those standard precautionary measures, we think it's important that she still stay with her baby and still breastfeed.
Thanks, Larry. One thing that came to mind, you mentioned about skilled breastfeeding counselor. What kind of training that they actually get, and what kind of special skill actually that they can offer to mothers?
Yeah. So unfortunately, they don't get enough training. Around the world, we see the problem that there's inadequate training on breastfeeding support. It really needs to start in what we call pre-service training. So before they're actually functioning as a healthcare provider, when they're in medical school, or nursing school, or midwifery, wherever they're getting their education about how to provide healthcare, we need to make sure that breastfeeding is part of the education that they're getting. That includes how to counsel mothers on breastfeeding, as well as how to deal with the physiology and whatever problems might occur from breastfeeding. And so it needs to be built in from the start. We also would argue that we can't just wait for a new cadre of people with a new curriculum to come into working. We also need to be educating the existing healthcare workers. And so that means we need to have training courses, we need to have continuing education for them. There's always emerging science and emerging issues for them to stay up to speed with how to provide this kind of care. Unfortunately, what we see is that oftentimes breastfeeding education is the last thing that's prioritized. And so healthcare providers will jump on a course to learn about a new medicine that's coming out, or a new vaccine, or oftentimes even about a new formula that's been made available for special purposes. And they'll take a class in that, but they don't take the class in standard breastfeeding support. So we really need to change that. Tomorrow, WHO will be launching a new set of training materials, some that are for the purposes of testing that healthcare providers have received the skills that they need. And so it includes a set of questions for knowledge, a set of case studies to work through. How would you deal with this situation? So looking at the skills that they're getting, observation tools where they can be observed dealing with an actual mother, and did they actually perform the kinds of services that they're supposed to perform, and checking off then that they do in fact have the competencies that they're supposed to have. We'll also be launching a new training course for hospital care of new breastfeeding mothers, and a new course about the care of preterm babies and small, low birth weight babies, and the special issues that they have for feeding. And so all of these materials will be out tomorrow for enhancing the capacity building of health workers around the world.
Thanks for sharing, Larry. That sounds very interesting. So tomorrow we'll have this training materials, and maybe you can also tell our audience, Larry, where this training will be available.
So it'll be on the WHO website. We have a particular link for all of our breastfeeding materials there. So I think if you just Google WHO breastfeeding site, and on that page there's a section for publications. So all of these will be included as new publications on that breastfeeding kind of home site within WHO.
Thanks, Larry. And you could also saw earlier on the screen our website, which is www.who.int. It's on the screen. Another question about training, Larry. Our followers from LinkedIn ask, is there a training organized by WHO for stakeholders globally on breastfeeding practices among COVID-19 positive mothers, considering the current evidence that you just mentioned, that breastfeeding is fine and recommended actually during COVID-19, because the person said that some healthcare professionals are actually not aware of this recommendation by WHO.
So we've produced a number of communication materials that are online. They're mostly oriented toward health workers. There's a scientific brief that lays out the scientific arguments for why did we come to the decision that we did. There's the guidance itself that is accessible for, that's part of the general guidance on the care for COVID patients. There's a section in there specifically for the care of patients with new babies or young babies. And it is focused within that. So any healthcare provider who is working on COVID should be looking at the WHO guidelines on patient management. There are also materials in a frequently asked question that go through the rationale and many of the questions people have asked us about this guidance, and tried to put it into somewhat simpler language for people. There's a video available from the Partnership for Maternal, Newborn, and Child Health that talks about the importance of breastfeeding patients. We have question and answer on the WHO website, answering these in very easy to understand and more generally for the public. And there's an app that WHO has created called the WHO Academy that you can download onto your website, or onto your mobile devices. And within that, there are training materials, PowerPoint presentations, and then all of these documents that I just talked about are accessible in that app. So you don't even have to be online to get access for it. Once you've downloaded the app, then you'll have access to all of this information about breastfeeding and COVID.
Great. So that's a lot of source of material already. So go to our website, www.who.int, and you can find a lot of material like what Larry just said. More questions from Facebook. What is the role WHO plays in reducing transmission of COVID-19 from breastfeeding mother to Marcel Benoit? Thank you again for joining us today, and see you soon.
Thank you, Sari. It was enjoyable to talk with you.
Thank you. Bye. Hi, everyone. Thank you for joining today's live Q&A with WHO expert. I'm your host, Sari Satyogi from WHO Department of Communication. And with me today is our unit head for Food and Nutrition Action in Health Systems, who is also our breastfeeding and nutrition expert, Lawrence Grummer-Strawn, who we all call Larry. Hi, Larry.
Hi, good afternoon. How are you?
Good. How are you doing?
Doing great.
So we're connecting today from our homes. We're still working from home. And as some of you might know, this week is World Breastfeeding Week. It's important to support breastfeeding moms, not only this week actually, but throughout the year. And in previous breastfeeding moms, actually, not only this, we live Q&A, we actually received some comments that our breastfeeding expert is actually a man. Yes, and we are actually very proud about that, because when it comes to breastfeeding, it's not only the mother's role, but also the partner, family members, friends, everyone plays a role in supporting breastfeeding to be successful. Right, Larry?
Absolutely, and that's been the story of my career. Is I'm in a field that's kind of dominated by women, and clearly the practice is one that's carried out really only by women. But as a man, I'm really here to call for that broader societal support for breastfeeding, and what are the things that we can do in our health systems and the actions that we do as a society, the support at work. I'm really trying to push for that kind of support for women.
Great. Thank you, Larry. And for you who are joining us today, feel free to ask your questions around breastfeeding and also on breastfeeding and COVID-19. Post your comment on Facebook, or if you are on Twitter, then ask your question, use hashtag AskWHO. So we're talking about COVID-19, Larry, because aside from the breastfeeding week, it's actually the top questions we have been getting across our social media is about breastfeeding in time of COVID-19 pandemic. I think we understood that mothers, parents, especially new parents, are worried about their chance to breastfeed during this pandemic. So perhaps we can start with that, Larry. Is it actually safe to breastfeed